Hi class, it's Dr. Balderas. This is just a little tutorial on ultrasound soft tissue mobilization, practical for you. You can grade me on this. I guarantee you I won't hit all your points that are on your rubric, so you can let me know how I did. So first off, you have your chart, and yours is going to be very simple for this practical. It'll pretty much tell you the age of your patient, their gender, and what their condition is that they're coming in for. So today I have Danielle Balderas, who has volunteered to be my patient, and she has a right gastroc strain from about 2-3 weeks ago. She's training for a half marathon, and she just has some soreness in there that's starting to create maybe some tightness in that calf and also in the anterior part of her leg. So we're going to try some ultrasound today and some soft tissue mobilization to help her out. So first thing I'm going to do is I'm going to check my machine. I am going to use one that I can change the sound head. So this sound head here is going to be a little bit too small for her gastrocnemius, so I'm going to probably put it up to the 5 centimeter squared one. I'm going to check the plugs to make sure they're not frayed, and hopefully, because this is a brand new machine, we would worry that it was frayed. That would not be a good thing. I'm checking the plugs. It's got its nice little green dot to tell us that it's been calibrated, and we're going to plug it in. Use my good body mechanics, and we're just going to stick it in the hole there, and that works. And I'm going to turn it on just to make sure it works. And while we're waiting for that to warm up, I prepared my area. I got my ultrasound gel. I have my cream for the soft tissue mobilization with a clean stick. I have some alcohol wipes to wipe off the sound heads before and after. I have a gown in case I needed to use that with my patient. I have some towels for draping and to clean things off. So I'm going to go ahead and change the sound head. So I'm going to take this guy out. And we're going to put him in a nice spot so he doesn't get all coiled up. And whoever used the last one did a great job doing the same thing. And before I put it on, it's probably going to be easier for me to look at that BNR before I actually plug it in. So we want to make sure this is between 2 and 8 so that we don't have those hot spots on the patient. For me, it's a little more challenging because I don't have my glasses. So if you need glasses, you want to probably make sure you have those prepared as well. This is a 5 centimeter squared ERA, and its BNR is 6 to 0, so we're good to go. I've checked the sound head and the transducer for any cracks or any kind of uneven surfaces, and it looks really nice there. And then now we're just going to plug her in. So we look at the rounded part is the part that's going to go on top so that we plug it in the correct way. And that should just go right in, and because you're watching me on the computer, there we go. And we are set. Stick that in there. My parameters, because I know it's her gastroc, I'm going to hit this. I'm going to go ahead and pause the camera for a second.